I feel there are a lot more psoriasis options available today, absolutely, than when I was initially diagnosed. When I was initially diagnosed, topical treatments were really the only thing available, and since I guess the last 10 years, I've noticed that not only are there biologics that help patients, but the extract, the light box, and honestly, I wouldn't know about any of them until I had come to Dr. Prussick. So really, he's been my savior.
Well, once I'm confident with the diagnosis of psoriasis, I explain to them that this is a genetic disorder that is something that we can manage very well now with the treatments that we have. I try to find out the quality of life scores from a patient with psoriasis to see how much this is affecting them, both psychologically, in their work or in their home, and try to get an assessment of how severe it is for them. Because people handle things differently. Some people with mild disease have a harder time with it than some people with severe disease, and vice versa. So people handle conditions differently, and I have to take that into account. And so that's how I figure out whether or not the patient needs systemic treatment or biologic treatment or phototherapy. It's based upon not only how severe their disease is, but also how they handle things psychologically and how this is affecting their activities of daily living. Well, generally what we do for people who have psoriasis is if they also have it in their joints, that makes me believe that I should be treating them with a TNF-alpha inhibitor. So if patients with psoriasis who have moderate severe disease and they have arthritis as well, or symptoms of arthritis, I'll be thinking more along the lines of treating them with a TNF-alpha inhibitor, which will treat both conditions. If they don't have psoriatic arthritis and they just have skin disease, then I may treat them with topical therapies or with ultraviolet light therapies. It just depends upon their condition. Knowing the family history of a patient is always helpful in trying to determine the prognosis or whether someone is going to develop a severe case or a mild case. But every case is an individual case. So knowing their family history doesn't always help us in determining how severe the condition is going to be or what their prognosis is going to be over time.